The adrenal glands produce the fight or flight hormones adrenaline and cortisol, and sex hormones related to testosterone and estrogen. But the adrenal glands can also develop tumors that secrete excessive hormones. Sometimes these tumors can be cancerous, known as adrenocortical carcinoma or adrenal cancer.
Adrenal cancer is extremely rare. Because it's so rare, therein lies the problem with diagnosis, treatment, and research.
Our understanding of how these tumors come along is still not very well described.
I looked it up online, adrenal cancer, and then I started getting some disturbing information.
I was astounded. I certainly started to tear up. Cancer? You know, how could I have cancer?
I saw Spence and it didn't feel real. It was, seeing this vibrant young man confined to a hospital bed at the age of 20 and with the knowledge that he was going to pass away.
I'm Dr. Scott McFarland. Join us as we look at one of the rarest forms of cancer and one of the least understood, adrenal cancer. We'll see what some adrenal cancer patients and their loved ones are doing to change all that, including a Pulitzer Prize-winning poet, an internationally known movie star, and a graceful teenage dancer. That's all coming up on Healthy Body, Healthy Mind.
Major funding for Healthy Body, Healthy Mind is provided by Baxter and by Celgene, committed to improving the lives of patients worldwide, and by Mallinckrodt Pharmaceuticals, dedicated to providing safe and effective medications and committed to helping ensure their appropriate use for a healthier world. Additional funding provided by DePuy Synthes Joint Reconstruction.
Imagine coming down with a form of cancer so rare your doctors may have never heard about it, and so would not even know how to properly diagnose the cause of your symptoms. And even when a diagnosis is made, few treatment options are possible. Such is the case with adrenal cancer. But with the help of a team of doctors at the University of Michigan and some beautiful artistic expressions of patients, family, and friends, that may all be about to change.
Please allow me to introduce myself. My name is Spencer, but you can call me what you wanna.
20-year-old musician and artist Spencer Bell was living in Madison, Wisconsin, in the midst of an outpouring of creativity, writing poetry, recording music, and touring with his band. He was full of life. On Thanksgiving Eve, 2006, he picked up his brother at the airport, where he began to complain of abdominal pain. The pain had been a reoccurring problem for Spencer. His brother rushed him to the hospital at the University of Wisconsin Medical Center, where doctors found a 7.5-inch tumor on his adrenal gland.
Spencer was a boy who grew up outside of Detroit, was a gifted musician from a young age.
Dr. Gary Hammer was one of Spencer Bell's physicians. He is the Millie Schembeckler Professor of Adrenal Cancer at the University of Michigan and director of the Endocrine Oncology Program at the Cancer Center there.
Spencer played music and for some time went to Interlochen in northern Michigan, a wonderful art school.
One longtime friend and creative collaborator from their Interlochen days was bandmate Jackson Rathbone. They were part of a circle of friends known as the Lost Boys for their creative dress and behavior. Rathbone went on to international fame as one of the stars in the Twilight movie series.
I got a call just after Thanksgiving, I believe it was. An old friend of mine told me that Spencer, he had stage 4 cancer and it wasn't going to last very long and I should get up to see him. It didn't feel real. This vibrant young man confined to a hospital bed at the age of 20 and with the knowledge that he was going to pass away. He knew this and he had accepted this. And he accepted it with this beautiful radiance, this exuberance. From the time I saw him, it was 4 days. I got there, he was doing well, and just immediately started slipping. And the 4th day, he passed. There was no pharmaceutical company backing up. There was no money to invest in trials or even just the science behind what is this rare cancer that is killing people so quickly.
So despite all the best efforts of his medical team, after 11 days in all, Spencer Bell was dead. The cause was adrenal cancer. Until the last century, very little was known about the function of the adrenal glands.
The adrenal glands are hormone-producing glands that sit above the kidney. Without these hormones, your blood pressure drops, your blood sugar drops, and you simply can't deal with the stress of normal life. The hormones, when made in excess, cause the body to go into overdrive by holding on to too much fuel and or secreting too many stress hormones to make you anxious, for example.
These tumors, while not always malignant, can indeed become cancerous and at times result in the excessive production of hormones.
In the adrenal gland, we have very few risk factors understood at this point. With that said, they're quite common, adrenal tumors. There's over 10 to 15 million adrenal tumors in this country a year, but very few of them end up being cancer. As to the causes for adrenal cancer, it's been a very difficult nut to crack.
We don't really have a good idea why out of nowhere these tumors occur in patients.
Dr. Tobias Else is an assistant professor at the University of Michigan. Dr. Else is part of Dr. Hammer's research team at the university.
What we know, though, is that there are some patients which seem to be born with a predisposition to develop adrenocortical cancer.
One risk factor might be gender.
Dr. Thomas Giordano is a professor of anatomic pathology. For years, he has been collecting and studying tumor samples, which were the foundation of the University of Michigan's pioneering research on adrenal cancer.
Patients can often have no symptoms and walk around with large tumors for a long time. They can have local symptoms like back pain, but if the tumor is not making a hormone, they can grow for a long, long time before being discovered.
The challenge with adrenal cancer is that it's so rare that most doctors have never seen a single case in their entire career. It's very difficult to diagnose. Adrenal cancer is usually diagnosed in 2 ways. When extra hormone is made, it changes the body in certain ways and produces certain symptoms that will alert physicians that something may be hormonally wrong and will lead you to the diagnosis of an adrenal problem.
One effect of adrenal cancer is Cushing's syndrome, or hypercortisolism. This excess cortisol in the body leads to a constellation of symptoms.
Too much cortisol results in these 3 classic symptoms: weight gain, sugar problems, diabetes, and high blood pressure.
Usually muscle weakness or other signs such as rounding of the face, as well as some facial flushing in female patients. This can lead to a man-like appearance, sometimes even more increased facial hair growth and other symptoms such as acne, deepening of the voice, and irregular periods.
Adrenal cancer is oftentimes diagnosed late because it's so hard to diagnose. When patients present early with the disease and we can resect, surgically remove a tumor, we do, as that would be the only possibility of true cure.
The mainstay for actually diagnosing adrenocortical cancer is a combination of a clinical exam and, of course, imaging such as CAT scan and MRI. Or there are also some more advanced imaging methodologies such as PET scans.
Because it's so rare, there is very little research effort put into understanding adrenal cancer, and therefore there is very little new treatments that have evolved in the last 50 years.
And this is, of course, something that is very, very difficult to obtain if you just think it's only 500 to 1,000 new diagnoses in the United States per year.
But we need to change the playing field, and we need to come up with new targeted therapies to attack this disease.
The relationship between a doctor and a patient is at the very foundation of care for a rare disease like adrenal cancer. Patients can feel abandoned simply because their doctors and other medical professionals are so unaware of the disease. Dr. Hammer and his colleagues at the University of Michigan decided to do something about that for patients. They now work together in a multidisciplinary clinic that focuses exclusively on endocrine malignancies like adrenal cancer. Tumor boards are held after each clinic, during which extensive discussion, evaluation, and treatment decisions are made on a case-by-case basis.
Through these discussions, we actually come up with the right approach, and whenever an adrenocortical carcinoma is diagnosed, it should definitely be removed in its entirety. The second approach is radiation therapy, which will hopefully lead to cessation of growth of these tumors. The third option is actually medical treatment, a drug called mitotane, which is a derivative of the pesticide DDT, and that actually has a toxic effect on adrenocortical cells and also on adrenal tumor cells.
Since its first use in 1959, mitotane remains the only approved drug in the world for this disease.
At first, I was pretty much in denial about my symptoms. My symptoms were strange.
Ray Armentrout is a professor of poetry and poetics at the University of California, San Diego. Ray published her 10th collection of poetry, called Versed, in 2010.
I started growing a mustache. I thought, well, this is a bummer. I started to get more muscular. And then the blood test came back very abnormal. So then she had me do a CT scan. An hour later, she called me on the phone and she said, you have to get to the hospital tonight. You have this really large tumor, and we're going to send you to see this oncological surgeon. I came home, looked it up online, adrenal cancer, and then I started getting some disturbing information.
Wendy Holman from Yorktown, New York, is a senior director of a life sciences consulting firm in Massachusetts.
I was 42 years old when I was diagnosed in September 2007. Symptoms started about a year and a half prior to that. Hair loss, excessive sweating. My cholesterol started to climb, and eventually my face started to get very large. And I didn't notice it. It was very gradual. And my sister-in-law said, wow, your face is very large, your limbs are very thin. I diagnosed myself with Cushing's syndrome online. I went to the doctor and I said, listen, I diagnosed myself with Cushing's syndrome because I have every single symptom. They just did an MRI of my adrenal gland, and they found the 8-centimeter tumor on my adrenal gland. Within a month, they had the tumor out of my body with the surgery done. They don't know what's going to work, and the internet says that you're going to be dead. You're not going to last beyond 5 years. You know, there's a 5% chance of you living beyond 5 years. 95% of the people with stage 4 adrenal cancer will pass away. Unfortunately, just this past February, they found it in my lung. So they went ahead and just sort of cut off the bottom of my right lung. And right there in the microscope determined that it was adrenal cancer.
We built this program here at Michigan to sort of bring together pathologists, radiologists, endocrinologists, oncologists, and surgeons to give patients that confidence that they're at a place that has some experience. I've been collecting frozen adrenal samples since '94, and as a consequence, we here at the University of Michigan have one of the best single institution collections of adrenal samples to work with.
While the specialists work tirelessly to find answers in the laboratory, some surviving patients, their families, and friends have joined the effort to help bring attention to this extremely rare cancer. Their solution? The art of poetry, dance, and music. Coming up, we'll see how adrenal cancer patients, their families, and friends are fighting back through the arts. The adrenal gland was first recognized by Eustachius in 1564. 300 years later, Thomas Addison discovered the adrenal failure we now know as Addison's disease. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. Because adrenal cancer is so rare, affecting so few, government research grants and pharmaceutical company interest has been hard to come by. And it's difficult to gain the groundswell of public support that more common cancers often enjoy. What to do? Scientists, patients, and friends and family have decided to take a more direct approach to addressing the problem.
Patients have formed their own advocacy groups, their own awareness groups. They have fought on Capitol Hill for rare cancer legislation. They have banded together to apply for grant funding with the National Institutes of Health in association with health centers.
And they have also started to earn attention and money a different way, through the arts.
The art of medicine is more than just a metaphor. They play a huge part in human culture and have forever played a large part in healing and in suffering. The arts speak to the human spirit. The arts let you safely into difficult waters.
For poet Ray Armentrout, she faced her difficult waters through her mastery of words.
I actually started to write more. It turns out that even a death sentence can be a new experience. Sort of a mockingbird in that I pick up the songs I hear. I pick up language. I picked up the language of cancer.
And pick it up she did, and made it a focus of her book of poetry called Versed. Ray was halfway through her writing of Versed when she was diagnosed. She says the diagnosis allowed her to explore her life from an entirely new perspective. When the collection was published, she was awarded the Pulitzer Prize for Poetry.
Around. Time is pleased to draw itself out, permit itself pendulous loops, to allow them meaning, this meaning, as it goes along. I was reading from Versed on NPR, and Dr. Hammer happened to be listening.
Ray dives deep into that vulnerable place of patient diagnosed with a rare and fatal disease and shared it with the world. She spent 2 weeks sharing her experience with both our poetry department and our School of Medicine about the doctor-patient relationship, medicine and the arts, and poetry. She captures the balance between hope and reality in her poetry. That's what spoke deeply to me as a physician.
Ashley Bonner, niece of adrenal cancer patient Wendy Holman, is a remarkable 19-year-old woman. For the last 5 years, Ashley has painstakingly coordinated dance recitals with 100 or more young girls in Yorktown Heights, New York. They danced to both honor her Aunt Wendy and to raise awareness of the disease and funding for its research.
When I was 13 years old, I found out my aunt was diagnosed with adrenal cancer, and my family and I were devastated, and I was in disbelief, and I wanted to do something to help.
She called me one day and she said, you know, Wendy, I'd like to do something for you. I'd like to put on a dance show and choreograph the entire thing and collect a bunch of children and try to raise money for your cancer.
With the help of her parents, siblings, and friends, Ashley has brought together an ever-growing group of dancers, teaching them the choreography she designed.
Seeing what Ashley did, just do this for a cause that is so underfunded, was unbelievable.
She gave me this big hug. She was just so proud of all of us. The first year, my goal was to raise $4,000, and we ended up raising $15,000. And altogether, within the 5 years, we raised $84,000 for adrenal cancer research.
Through dance, you can actually make people aware of a disease that otherwise they would never be aware of.
If I think about the inspiration that Ashley is providing through dance, the operative word would be can do. For me, my experience of the relationship of art and medicine started with a patient, Spencer Bell.
He was extremely talented not only as a musician and a songwriter, as we will all soon find out, but he was also a very talented artist and poet. You put your piece of yourself into your art, your soul, and that lives on. I was blessed to be able to know him for those 5 years.
Please allow me to introduce myself. My name
Deeply moved over the loss of his friend and newly empowered by his worldwide celebrity in the Twilight movies, Jackson Rathbone committed to preserving Spencer Bell's legacy.
Town with some people I know and a bunny named.
When it took the life of my friend, we started the Spencer Bell Legacy Foundation, and we would play his music and we would release his music, and we would raise money for the awareness of this orphan cancer. They hear the story and it just hits them in a much deeper level, and they are aware through the arts.
I only bring it up because you look like you might want to hand somebody something. I only brought it up because you look like you might want to hand somebody something.
Patients with adrenal cancer make a profound difference in their own care by helping others, by raising research funds, by advocating for their own needs. It's powerful. It's very powerful to be part of that.
As for our patients, they look forward to a time when others will not have to suffer as they have.
It's 8 years later, and I'm still alive, and it hasn't come back.
When you have adrenal cancer, you feel like you're ignored. It's so rare that you just want to say, we are here, we are here.
Research may sometimes move more slowly than the needs of patients, but Dr. Hammer and his team are optimistic that they are making big strides in terms of finding ultimate cures for this deadly disease. And as you can see, there's just no stopping people like Ashley, Wendy, Ray Armentrout, and Jackson Rathbone in their efforts to raise awareness and funding for adrenal cancer. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itv.org. isus.com. Or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by Baxter and by Celgene, committed to improving the lives of patients worldwide, and by Mallinckrodt Pharmaceuticals, dedicated to providing safe and effective medications and committed to helping ensure their appropriate use for a healthier world. Additional funding provided by DePuy Synthes Joint Reconstruction,